Welcome. So, as an online therapist, I'm often asked for help with agoraphobia. And I'm often asked, is it possible to overcome agoraphobia without using medications? And it is entirely possible. In fact, it's necessary that you learn how to overcome your anxiety without medications. Medications may provide temporary relief, but they do nothing to change the underlying psychological process that causes your anxiety. So until that is healed, until that is changed fundamentally, then the anxiety will persist. And eventually the medications lose their effectiveness, and you have to change the dosage or try different medications, and it goes on and on forever without really changing anything at the core level. So it's understandable that people want to escape their emotional pain. That's quite human, it's quite natural. But you have to understand that's not a good long-term strategy. You must heal things at the psychological level. So during the online therapy sessions that I offer for agoraphobia, we focus very closely on the underlying habitual reactivity that creates that anxiety. We learn how to bring mindfulness and conscious awareness to look at the anxiety and see how it works. So the primary method that I'll be teaching you during these Skype therapy sessions, if you choose to work with me, is to learn how to meditate on your anxiety. Again, we don't use meditation to try and escape anxiety. That would be futile, like taking medications. We learn instead to use meditation as a way of bringing conscious awareness and compassion to our anxiety. We have to start seeing that anxiety as a part of ourselves, but not who we are fundamentally. We need to cultivate our true self, which is the observer that can see the anxiety and other emotions without becoming blindly identified with it. This is essential. This is part of the core process of healing emotional suffering. You have to be able to separate out from the anxiety so you can see it clearly as an observer. Then you begin to look at the structure of the anxiety. And of course, a big part of that structure is in the form of habitual reactive thinking. We tend to react to the anxiety by producing lots of anxiety-based thoughts, worry thoughts, what-if type thoughts, and so on. And that reactivity is a part of the structure of the anxiety. The reactivity has the effect of feeding that anxiety. So we need to see that very clearly. We need to see those thoughts and in the same way begin to break free from their influence by cultivating and training in being an observer, seeing the thoughts as more objects in the mind. Training to be the observer is how we overcome the habit of reactive identification, which is really the foundation of our suffering. Once you break free from reactive identification, then you can start to respond with compassion. This is a natural property of your true self. We all have this natural capacity for compassion. It's part of our fundamental nature. We may lose sight of it, but it's always there, ready to be rediscovered. So bringing compassion to your anxiety is like a parent caring for a child that is afraid. That is what promotes healing. Building that compassionate relationship promotes healing. Reactivity feeds healing because the reactivity itself is usually, if not always, fear-based. So reactivity such as avoidance or aversion towards the anxiety, seeking external ways to make it go away, which is a form of avoidance and aversion, like taking medications, are all fear-based. So there you're developing more fear in relationship to the fear you already have. So that is why reactivity feeds it. And if you identify with the anxiety, if you become that anxiety, then you feed it even more. So we have to watch for all forms of reactivity. We don't have to beat ourselves up and be self-critical. We're not trying to say, I should not be reactive. That is silly and pointless. What we're trying to do here is to simply awaken to that fear that is motivating us to become reactive, to see the reactions clearly as the observer. This is what produces real change. So we do this by meditating on our anxiety. We actually take the initiative here. Rather than living in fear of our anxiety, we actually seek it out. We might do a series of exposure challenges in order to find that anxiety so we can then start to work with it mindfully. So this is part of the mindful approach that I call mindfulness-based exposure therapy, which is what I have found to be the most effective approach available. It works extremely well, even for very extreme forms of agoraphobia and other anxiety disorders. You have to learn to build a conscious, mindful relationship with your anxiety. You then explore all of the reactive thinking that feeds it, and you learn to develop a conscious and compassionate relationship with those thoughts as well. The more you do that, the more you're training to become your true self again. That which is free from anxiety, that which is free from reactivity. So that is the benefit of doing this kind of approach. It helps the anxiety heal. So you're teaching the anxiety how to heal itself by being present with it as a compassionate and larger true self. And in that process, you're also growing as your true self. So you get both benefits in this process of mindfulness therapy. So in the exposure therapy part, we simply set up a series of challenges, and you work through each challenge using mindfulness. This means that you learn to meditate on the challenge. You play it through in the mind. You imagine doing that challenge. You watch for the anxiety that may get triggered out of habit. And then you start to work with that anxiety using mindfulness to help it heal. You look for the reactive thoughts that tend to blindly proliferate. You watch to see those, and you neutralize those simply by seeing them clearly. If you don't identify with those thoughts, then they have no power to feed the anxiety. So we train with it. We train with the anxiety. We train with the mind. This is how we gain real freedom. Medications do not allow this process to happen. But when you start to take charge and work with your anxiety, you can train yourself out of any anxiety until you feel complete freedom again, which is your true nature, your true self. So if you'd like to learn more about this process, simply contact me and let's schedule some Skype therapy sessions. You'll see very quickly just how effective this approach can be for overcoming agoraphobia without medication. Please contact me, tell me more about yourself and what you've tried so far, ask any questions you may have, and when you feel ready, we can schedule your first Skype therapy session. And after 3 or 4 sessions, you will start to see dramatic improvements, and you'll start to feel that there's a very strong possibility of actually overcoming your agoraphobia. So please contact me if you would like to get started with online therapy with me. Thank you.